Why aren't doctors considering genetic factors for ulcers? You might wonder why genetics don't seem to be the main focus when it comes to ulcers. Well, doctors do recognize that genetics play a role, but they are not the primary concern in diagnosing and treating peptic ulcers. The main reason is that environmental factors, like infections and medication use, have a much bigger and more direct impact on ulcer development. Peptic ulcers mainly happen because of damage to the stomach or duodenal lining caused by Helicobacter pylori bacteria or long-term use of non-steroidal anti-inflammatory drugs. These are well-understood modifiable risk factors that can be easily tested for and treated. While genetics can influence how susceptible someone is to infection or how much acid their stomach produces, these influences are complex and less straightforward to address in everyday medical practice. Research has identified certain genes that might increase the risk of developing ulcers. For example, genes involved in how the body responds to infection or how much acid is produced, such as MUC1, MUC6, FUT2, and others, have been linked to increased risk. But these genetic factors tend to have only a modest effect and are often intertwined with environmental influences like diet, smoking, and stress. Twin studies show that about 30 to 40% of ulcer risk can be attributed to genetics, but the rest mainly comes from environmental factors. Things like smoking, stress, diet, and medication use play a much larger role. Interestingly, genetic susceptibility to ulcers does not necessarily mean someone is more likely to get infected with H. pylori itself, which suggests that shared family environments and lifestyle habits are significant contributors. Currently, genetic testing for ulcer risk is not routine because it is not yet practical or cost-effective. Most doctors focus on the causes they can treat directly, like eradicating H. pylori or reducing NSAID use. As research advances, genetic factors might become more relevant, but for now, they are considered secondary. In summary, genetics do influence how susceptible someone might be to ulcers, but they do not directly cause ulcers. The main drivers are environmental factors like infections, medication use, smoking, and stress. Because these are easier to identify and modify, doctors prioritize them in treatment. Genetic testing is not yet a standard part of ulcer care, and current guidelines focus on proven, actionable causes. This approach ensures patients receive the most effective, evidence-based care while acknowledging that genetics are an underlying, secondary piece of the puzzle. Always consult with healthcare professionals for personalized advice and treatment options.